obvious from this conversation that we're talking about osteoarthritis across the age spectrum, and we're probably talking also about stages of osteoarthritis, degrees of severity, degrees of impact of osteoarthritis on the patient. But if we think about the early diagnosis of OA we were talking about a few minutes ago, let me ask, how does your therapeutic approach differ in the early stage animals versus maybe those with advanced disease? Start with you, Mark.
It will begin with weight optimization, clearly. If they're already lean, make sure that they are kept lean. If they are overweight and not necessarily even obese, because we tend to, when we're putting on that 1 to 9 scale, we tend to cheat and we say that's a 5, it's really a 6. And we say it's really a 7. So we need to, even that 10-15%, that much makes a difference. And over a period of time, humans that have excess central adipose tissue, that is abdominal fat, will double their risk for any kind of chronic pain syndrome when they're older. So it's really crucial. So that is where we try to start. And I'm not saying my patients are any skinnier than anybody else's. It's a chore, and it's difficult, and it's in fact, let's just be honest, it's kind of hard to monetize that kind of a thing. But it is crucial. We'd be remiss if we didn't just emphasize.
So that's something that in the early stage OA you focus on.
It's the most important thing, and the data is clear about that, both in humans and in animals as well.
How about other things, Bryan? Do you?
Yeah, I kind of think about managing these guys or addressing them in the young versus old, in that in the young I'm doing things that help prevent or slow the progression. So if I find that puppy that has joint laxity and is at risk for hip dysplasia, maybe something like a JPS to help kind of improve joint congruity and help them down the line. And then addressing other things secondarily, but things like weight management, joint diet, keeping them thin through their lives, all of that, just to echo that's absolutely perfect. As they get older, it changes a little bit. When they present to me older, because a lot of times being a referral practice, we see them referred in. I haven't managed them their whole life, and so when they present in older for osteoarthritic pain, then I'm focusing on, much more heavily on what strategies I can use to relieve that pain and discomfort and get them moving again, get that muscle mass up, reduce the sarcopenia, or help kind of build that muscle mass back up and get them mobile and improve their quality of life ultimately.
So it sounds like many of the things you're thinking about in these younger patients are lifestyle changes, trying to prevent deterioration in the future.
Nutrition.
Yeah.
Nutrition,
preventative
exercise.
Measures.
Yeah. And many of the patients I see, the young dogs, have altered body carriage, altered body position, and all animals and humans are programmed to minimize work, to minimize energy expenditure. So when I see these animals that are bent over, leaning forward, have rounded backs, I interpret that as they're expending a lot of energy to avoid something significant, which means significant pain. So let me just get everyone's input on how important do you think effective pain control is in these younger patients?
I think it's critical. Yeah, I think it's critical. I also think, things like doing pain and also including the potential for physical therapy activities that could work collectively with effective pain management to increase their muscle strength in those certain areas that may be sore, or reducing joint pain, and all of those items can work really effectively together.
I agree that it's critical. The other thing that I think, and Sheilah can talk more about this, is thinking about the whole environment, the home environment. Is accessibility controlled and thought about? Do we make every effort to make sure that these patients can remain active and mobile? So do we make it as easy as possible for them? Are there rugs if there are slick floors? Are there stairs so that they can get up to that bed that they like being on, so that we make sure that we keep them moving?
Yep. I think if it was an elderly person who had mobility issues, one of the things that happens is they have a in-home assessment. So they go to the home and look around the home. That is possible. Some veterinary services offer that, but I think you need to really see almost pictures of the owner's home, and if you find out that the dog who is quite impaired is in this beautiful home with all hardwood floors, you're like, okay, so now we need to talk about buying some yoga mats, buying some rugs. for cats, if you think about what is important to a cat, it's living in a three-dimensional world, and one of those three dimensions that's most important is height, right? So they can see over their territory and their domain, but to be in their favorite place. So is that cat able to get up there? And you can do simple things like make places that are important to the animal much more accessible. You'll have the dog where the owner says, well, you know, he doesn't go out, you know, and then you have the house soiling issues that start up. But then if you actually say, well, how easy is it to get out of your house for that? And you realize they have to go downstairs, you know, they might be living in a city, they're going downstairs. Well, it's not easy anymore, and it takes time. And so then you have these other issues that can be very frustrating for the owner, but it actually could be a fairly easy fix when you understand the home they're living in, accessibility, and just thinking about some of these dogs that it can be night and day if you just say, well, why don't we get them one of the help-up harnesses?
Yeah.
So you can, you know, because once you get a lot of these dogs up, they're great, they can get going. And just this the simple thing of saying, why don't we get a harness for your dog, can make all the difference to that owner and the dog, of course.
Yeah.